You've been minister for a year. I didn't see anything about this in the subs. Do you have a plan to address this problem that is in every province that you're unwilling to call a crisis?
Research shows that an emotionally present male partner is the single biggest predictor of a happy, healthy marriage.
What? Oh, yeah.
Said that safe consumption sites save lives. Several other Conservative members have spoken to you about this study of what happened after the consumption site at Red Deer, Alberta, was closed. Do you believe that that safe consumption site was saving lives?
Well, I responded to your colleague saying that I was going to look at this study in great detail. This is the first time I'm finding about it. I will read it. I'll look into it. And I've already told you this. All I want is work for the well-being of Canadians.
Consumption sites save lives. These researchers have found that following the closure of the site, there were no lives saved. There was no increase in death.
Quand les gens sont en crise et qu'ils vont mourir, oui, ça sauve des vies.
Well, when people are at the point of dying, yes, these centers save lives. It's clear. I've seen it with my own eyes.
Je ne parle pas de traitement, je dis de sauver des vies
I'm not talking about treatments, but saving lives in the heat of the moment, immediately, yes. And that is why, where this crisis exists in provinces where we have Conservative governments, there
mindedness towards the finding of this study that this particular site was not saving lives. If it was, we would have seen an increase in the death rate when it closed. Could you hypothetically accept that finding once you've read it?
Je vais regarder l'étude avec plaisir.
I will look into the study with great pleasure. We'll analyze it. We'll consult, and I will certainly talk to my counterpart in Alberta, because we are open to sharing best practices.
Mindedness is unscientific. It is not open-minded, and I think Canadians will be disappointed to hear that. New topic. Last year, 500,000 Canadians left an emergency room in Canada without seeing a doctor. They were after waiting for hours. My wife was one of them. She almost died. She was bleeding. She was waiting for 6 hours to see a doctor. Our son was 2 days old. I'm very happy that she made it. But many patients and families were not so lucky as my wife and I. Stacey Ross died in Winnipeg. Prashant Srikumar died in Edmonton. Alison Holthoff in Nova Scotia. Finley Vanderwerken in Oakville. Adam Burgoyne in Montreal. They all waited hours to see a physician, and after hours of waiting, many of them had not seen one. Over the Christmas break, a friend of mine died. He was in the prime of his life. He was 53. His name was Gord. Paramedics came to see him when his wife called 911. They told him the emerges chocker block full. You might as well stay here and try again in the morning. And he died over the Christmas break. Mr. Will you acknowledge that this is a crisis and that it's touching every region in our country?
Écoutez, je vous dirais que
Well, I wouldn't call it a crisis, but it is true that our healthcare system is under pressure everywhere. And there are provinces that are doing better, others not so much.
I have an example from each province.
parce que vous n'avez qu'à regarder
some provinces, because you keep referring to the emergency rooms, if you take it as an indicator, you can take a look across the country and see where
les provinces, j'ai dit, sont sous pression dans leur système.
All provinces are under pressure in terms of the healthcare system.
Well,
Mais je ne dirais pas qu'il y a une crise. Je peux
I
parler.
wouldn't call it a crisis. I see that the system is under pressure.
Seen at CHEO here in Ottawa.
Et vous savez que d'un autre côté, je comprends.
Well, I understand.
You've been minister for a year. I didn't see anything about this in the subs. Do you have a plan to address this problem that is in every province that you're unwilling to call a crisis?
Écoutez, comme vous le savez.
Well, listen, as you know, I work with the provinces and the territories. They are the ones delivering the services in the healthcare system. We are here to support them in terms of their priorities.
Would you agree with me that the federal document, the Canada Health Act, governs the delivery of healthcare in hospitals across Canada?
nous tous, nous fonctionnons en dessous du chapeau de...
We all function under, of course, the provisions of the Canada Health Act. That's sure.
Regulates the and has special authority under the Canada Health Act. Is that true or not?
The Canada Health Act provides a framework for ensuring that Canadians have a framework on which they have public
Sorry, I
health
asked the
care.
minister if she is the minister who oversees the act, and I'm
that's-
shocked that she won't take that responsibility. Thank you.
Just a reminder, gang, smash the like, hit subscribe. We work really hard at this stuff. Let's get back to the video.
Minister, because I didn't understand or get the full answer to my colleague's question, I'd like to re-ask it again. Is injecting fentanyl safe?
I'll help you. It's not.
Thank you, Mr.
The question is for the minister. Thank you.
President, for the question. I believe
Je vais encore vous répéter que les centres...
Well, I will repeat my prior answer and say that the supervised consumption sites save lives. But the federal government doesn't offer any services in these centers, at these sites. It's up to the provinces to do that.
I was trying to go about it in a nice way, but when I saw this core report, now, as you know, I'm from Red Deer. Red Deer shut down the opioid injection site. They paired it with another site that was still open, and they did this study. Have you literally gone through this study? Has your department seen it? I did bring copies if anyone would like one. This injection site decimated Red Deer's downtown. The damage that it did to Red Deer over the last 10 years has changed the way that Red Deer people walk around. And my point is, the Alberta recovery model is working so well in Alberta. Will the federal government look at this model and start to implement it in other provinces? You're shaking your head. Is that a yes or a no?
I'm listening to you. I'm
Okay,
listening to
so
your
with this study telling you that opioid injection sites are not doing what everyone says they should, and I can give you examples if you like, but I'm not sure if you've read it or not. Will you look at the Alberta recovery model and start to implement it in other provinces by shutting down opioid sites?
Écoutez, oui, je connais le modèle de la...
Well, listen, I'm familiar with the model in Alberta, but it's Alberta's model. It's not the federal government's model. And as I've already said, at the last federal, provincial, territorial ministers meeting, we made the decision to share best practices. Best practices from all provinces are shared with every other province. So the decision about treatment lies with the provinces.
The federal government are not going to give the provinces any direction. They are on their own. And it's evident that drug consumption sites are not only making communities worse, they're making Canadians suffer from addiction worse. And I'd like to know, why does the government keep promoting this when evidence shows they don't help Canadians break free from addiction? And as my colleague pointed out, you do have the power to close these sites. Why wouldn't you be advising the provinces that this is the direction we're going? We're not going to enable anymore. We're going to focus on recovery.
Comme je l'ai déjà dit plusieurs fois, je pense...
As I've already said many times, prevention and saving lives, and of course focusing on treatments, is what we want to do. You are talking about one study, and I'm really going to take a close look at it. The department will analyze it as well. But I've also seen studies recently that show that the supervised consumption sites can save lives.
Identical communities like this study that is here, and that's what's so unique about it. 100,000 people in Red Deer, 100,000 in Lethbridge. Same types of people. there is a lot more to this study than just saying you can compare it to the United States. Minister, do you believe that Canadians who are struggling with drug addiction should visit safe consumption sites to continue using illegal drugs or be treated for their addiction? So I'm asking, should we continue to enable or should we be looking at recovery? Just a straight yes or no. Enable or recovery?
Écoutez, on a des programmes qui supportent.
Well, listen, we have programs that support everything. So not everyone is at the same stage in this. To go towards treatment, people need to be ready. If they're not ready for treatment, well, we still need to save their lives. So one doesn't exclude the other. And of course, I'd like to see people getting treated. I mean, can you imagine a Minister of Health not wishing this?
Alberta recovery model, because the first thing that I've learned about recovery is you cannot enable. So thank you very much for your time, Minister.
Everyone has an opinion about Canadian federal politics. My name's Aaron. This is Canadian Looney. We're going to wrap it up. If you've enjoyed this video, please leave a comment below. Check out this playlist. Check out this video. Thank you all so much for watching. Smash the like, hit subscribe. Aaron at Canadian Looney. Ciao for now. We'll catch you in the next one. Thanks again for watching. We're out.